Hi everyone, thanks for joining me today. My name is Melanie Tan and I'm a Senior Associate in the Aged Care team at Russell Kennedy. I also happen to be a medical practitioner, recently retired from clinical practice. A key concept in the new aged care quality standards is the concept of dignity of risk, which is very close to home to me as a medical practitioner, being similar to the concept of informed consent. Dignity of risk is about the right to self-determination. It embraces our right to choose how we live, which includes our right to accept and take on risks. And we do these things every day. For instance, we might smoke or drink a little bit too much, knowing it might harm us. It's about improving our quality of life by choosing to take on risks. The concept of dignity of risk can apply to any situation, for example, even just swimming in the sea. As a medical practitioner, I would often see patients in the hospital who would want to self-discharge against medical advice. We can't force patients to stay in hospital, even though we think it's in their best interest to do so. It is their choice to take that risk and leave if they wish. In aged care, dignity of risk applies to everyday situations such as going for a walk or eating a normal meal, because these activities can be riskier for people in aged care than they are for people like you and I. A question we often get asked is how to balance duty of care with dignity of risk. In the context of aged care, it's about taking reasonable measures to ensure that a consumer doesn't come to harm. For example, a resident with dysphagia might want to have a steak despite the risk of aspiration. Another example might be a resident who refuses to use a walker despite their risk of falls. And another common example is a resident who wants to take a walk down to the shops to buy an ice cream, even though they might get lost on the way back. Providers should ensure that they have clear processes in place to support the making of informed choices by clients and their families. Please contact us if you would like any advice about developing a policy around dignity of risk.